Does a subtenons block hurt?
We make every effort to make sure that the subtenons doesn't hurt. We use numbing eye drops on the front of the eye before we start, and when we do the subtenons injection itself, you may feel a little bit of discomfort, but usually for only a few seconds. This may feel like stinging or pressure or a slight headache.
How long do the effects of the injection last?
That will depend a little bit on the mixture that we use and the type of surgery that you're having, but a typical subtenons anaesthetic would freeze the eye for between about 1 and 2 hours. If you're having a longer operation, we will use a mixture that lasts longer in the first place, but it's also very easy to top up the anaesthetic if necessary during the surgery.
Are there any side effects?
The commonest problems with subtenon injection are that it causes a little bit of redness or bruising around the eye, sometimes a little bit of swelling. It can also reduce your ability to see very well, but only for as long as the anaesthesia lasts. The bruising is completely harmless and goes away by itself if you experience it. And serious complications with subtenons anaesthesia, although they are described, are extremely rare.
Am I allowed to eat and drink before having a subtenons block?
You are allowed to eat and drink on the day of surgery if you're having a local anaesthetic. This is because you'll be awake during your operation.
Should I take my heart and blood pressure medication as usual?
Yes, you should always take your blood pressure medications as you normally would.
Should I take my diabetes medication?
If you're having a local anaesthetic, you should take your diabetes medication on the day of surgery, and you should continue to eat and drink as normal.
Should I take my blood thinning medications?
You should take your blood thinning medications prior to surgery unless you've been given specific instructions to stop those, and that will be discussed with you by the surgeon and the pre-assessment clinic.